Hello all. So today what we're going to look at is pathophysiology. So of course that is just looking at the physiology in disease states or the mechanisms of disease state that lead to altered physiology. So really when we're thinking about pathophysiology, we need to firstly understand homeostasis as a whole. And whilst I realise this has been covered elsewhere, we just need to kind of think about how different organ systems have to work together to keep an organism healthy. For example, there are several organ systems that have to work together to produce vitamin D and then to actually have the effects of vitamin D doing the job that it needs to do. So really the first thing I'm going to, as you know, in my sessions, I like to get you to think a little bit. So even at this very early stage, only 30 seconds in, I want you to be thinking, what organs are needed to effectively produce vitamin D? And then where does vitamin D actually work? So it works in lots of different places, but we're thinking about the main ones that we really need to focus on. So press pause and have a little bit of a think about it. So vitamin D, well, interestingly, vitamin D is actually a steroid hormone, and that is because it is made out of cholesterol. So whilst it's called a vitamin, and that's how we know it, it is, like I said, a steroid hormone because steroid hormones are those that are made from cholesterol. So what are the processes that are undertaken, or what are the organs involved in the synthesis of active vitamin D? Well, first of all, the cholesterol within your skin gets activated by UV into the first precursor of active vitamin D. Then within the liver starts to activate it further to make an inactive form of vitamin D, and it's this what's called 25-hydroxy vitamin D that is actually measured in the blood to see whether people are vitamin D deficient or not. And the final place where vitamin D gets fully activated is within the kidneys. So in the kidneys, vitamin D is finally activated by the action of another hormone, parathyroid hormone, to make your vitamin D. So it's clear that actually we've got lots of processes going on. We need enough UV light coming to our skin, so skin needs to be getting that UV light. The liver needs to be working properly, and then the kidneys need to be properly working to enable parathyroid hormone, which is made in the parathyroid glands, to actually be able to activate that vitamin D itself. Vitamin D does have many roles, but the main one we need to think about is it increases calcium absorption and phosphate absorption across the GI tract. So it just basically moves or causes the movement of transporters for calcium and phosphate through the cell surface so that they can transport calcium into the body. And of course, calcium is used for many different things. So it's involved in generation of muscle contractions. It's involved in your bone structure and in your teeth, amongst a variety of other things. So that's one thing that we already know about. So we're thinking, oh right, so vitamin D it's involving the skin, the liver, the kidneys. It works on the bone. It works on the gut. We need parathyroid hormone to do it to give its final activation. So actually, lots of organs are having to work together. And it's the same thing if you're thinking about thermoregulations, trying to maintain a steady body temperature. And so what I want you to think about now, again, just a little bit of thought process, is what are some of the consequences if you get cold? So when you're thinking about these, I want you to have a look down this kind of system part of the table. So thinking what happens to your blood vessels, to your peripheral blood vessels, what happens to your skeletal muscle, your skin, what hormones are released and what are they doing, what happens to your respiratory system, heart, and also thinking about your behavior from a psychological perspective. And so all of these things are actually affecting different parts of the body. So you get cold, you're altering what happens in your blood vessels, your cardiovascular system, your skeletal muscle system, your integumentary system, your endocrine system, your respiratory system, your nervous system with behavior, and then back to your heart, which is cardiovascular. So again, press pause, have a little bit of a think, what actually happens? Okay, so what happens? Well, if we're thinking with the blood vessels at the skin, you get peripheral vasoconstriction. So that's basically moving blood away from the surface of the body to help to maintain your core temperature. Because of course, prolonged exposure to cold can lead to numbness in those extremities, and that's because blood flow is so restricted. And that can be obviously that numbness can be a sign of potential frostbite to come. What happens with your skeletal muscle? Well, they contract a lot. So you get that shivering. So those contractions causing the shivering, which is generating heat, which is helping to warm yourself up. What happens in the skin? You get goosebumps. So actually, you're getting your hairs are standing on end to help trap air across your skin so it starts to warm up. So you kind of have like a warm little layer. So there is smooth muscle that are controlling those hairs to stand up online and stand up. Endocrine system. So of course, this is where thyroxine and adrenaline kick in. So if you're really cold, adrenaline kicks in, which increases your heart rate, etc. And thyroxine is released, which controls your metabolic rate. And if you increase your metabolic rate, you increase the amount of heat that you produce. Now, thinking about what's happening with your respiratory system. So your respiratory rate might increase a little bit because you need that increased energy through shivering, amongst other things. But it also triggers, think about when you're out in the cold, you get a runny nose. So it's stimulating the production of mucus. What happens with the heart? Well, cold exposure can increase that heart rate and blood pressure as the body attempts to maintain circulation and blood flow to your vital organs. And finally, going to your nervous system, and behavior. Well, the nervous system controls lots of these other systems, so it's involved in altering the cardiovascular system, the respiratory system, and the endocrine system, because they're all being regulated through, well, for example, the endocrine system and thyroxine is being regulated through the hypothalamus. So you've got that kind of interaction behind them, but also thinking about motivation. So the motivation to put on a jumper, to jog on the spot, to move away from the cold. Or you might even just curl up to decrease that surface area. So we've all done that. You get into bed, it's really, really cold if you haven't made it nice and warm at this time of year. And so you curl up to try and decrease the surface area where you're losing heat. So when we're thinking about homeostasis and control mechanisms, that's kind of what we were just talking about. But the disruption to that process can be harmful. And that homeostasis can be disrupted for several reasons. So the sensors that are detecting these various signals, they may not work. So for example, if those sensory receptors are damaged and they can't detect changes. So classic example might be burns. So you might get burns that can damage your temperature receptors in the skin, preventing the body from sensing heat or cold. You've then got, you may have targets don't receive their messages. For example, so your sensor might work, but it can't get to the tissue that needs to work on it. And so, example, if you get a spinal cord injury, that can block your nerve signals from the brain to the muscles. That can prevent movement, even though the muscles themselves are absolutely fine, initially at least, until they start to atrophy. You've then got injury, where you may get overwhelming of homeostatic mechanisms or homeostatic controls. So your homeostatic mechanisms may be intact, but unable to cope with severe injury. So for example, in major blood loss after trauma, that can overwhelm the body's ability to maintain blood pressure. So the homeostatic controls have just become overwhelmed and they can't cope and they can't adapt or compensate appropriately. And finally, illnesses such as caused by viruses and bacteria, they can interfere with your normal physiological control mechanisms. Again, we thought about infections where they get the release of inflammatory chemicals that raise your body temperature, leading to fever. Perfectly valid response because that increase in body temperature slows the replication process down of bacteria. So it's helping to save the body as before the immune system really kicks in and gets rid of the injury or bacteria in this case. So a key thing about this, disruption of homeostasis can begin in one organ, but it can cause a chain reaction in others, therefore causing a major body disturbance. So an example, let's presume that you've had or someone has had a major blood loss. What are some of the consequences that actually potentially can happen? So I want you to just have a little bit of a think about this. I don't expect you to memorize these responses. I actually would more expect you to be able to work them out. You've lost a lot of blood. What's going to happen to the blood pressure, for example? Well, obviously it's going to go down and you feel lightheaded. What's going to happen to the amount of sweat you produce? Now, theoretically, if you've lost blood, you don't want to sweat, but unfortunately you do. your sympathetic nervous system kicks in, and that sympathetic, which is a perfectly appropriate response to blood loss, but unfortunately one of the byproducts is that you lose a little bit of fluid in sweat. What happens to your blood vessels? Well, you've lost blood, so you vasoconstrict to the non-essential organs. So that would be your GI tract, your renal system, your reproductive system, your skin, so your integumentary system. You vasoconstrict to those because you don't want blood going to them. You want it going to your heart, to your lungs, to your brain, and also to your skeletal muscle, thinking about fight or flight response, which is what's actually happening. And that increased constriction to the skin makes the skin cooler, but with the increased sweat, it can no longer evaporate because it's cool there, so you get this cold, clammy skin. We've talked about the heart already. That compensates for low blood pressure. That's going to increase its heart rate, and that gives you a weak pulse with less blood volume, so it's more rapid, but it's weak. It's also called thready, is the other way it's termed. Respiration, you get dilation of the bronchi. Again, that's a sympathetic activation process where the tubes or the bronchi that are delivering air into the lungs dilate out so more air can get to your respiratory system. And finally, the kidneys, obviously you vasoconstrict to the kidneys as they're non-essential, so you get a decrease in your urine production. So those looking at that, you just lose blood loss, which you're thinking, well, that's affecting the cardiovascular system. So you're losing blood from the cardiovascular system, but it affects a multitude of different systems. You could also think about the stress that kicks in. So the nervous system, the sympathetic nervous system kicking in, the anxiety that happens at the same time. So thinking about pathophysiology and the variety of cell stress mechanisms that you have, we've got four main ones that we need to think out, which are hypertrophy, hyperplasia, atrophy, and metaplasia. And so just for a minute or so, just again, press pause, but I want you to think about how would you define each one? What does each one actually mean? Bearing in mind that hyper means too much and hypo means too little. What are they? And can you think of an example? Okay, so press pause. So first of all, hypertrophy. So this is where you get an increase in your cell size, which results in an increase in the organ size. For example, if you have persistent high blood pressure, this causes heart myocyte cardiomyopathy. In other words, the left ventricle, the heart's muscle cells get bigger because they're pumping against a greater pressure because you've got high blood pressure. So basically, your heart muscle gets bigger, not in a healthy way in this particular case if it's hypertension induced. Hyperplasia. So this is where you get an increase in the cell number. Okay, so that might be due to prostate enlargement, so benign prostatic hyperplasia, but also in a variety of cervical cancers and warts as well. So, cervical warts, you get an increase in cell number. Atrophy. This is where you get a decrease in organ size due to reduced number of the cells or in their cell size. So you might get muscular atrophy during starvation. You might have a limb is in plaster for a prolonged period, so it's not being used, so the muscle shrinks, again giving the muscle atrophy. And you can get a liver decrease in size during liver cirrhosis or scarring and damage to the liver itself. So there are lots of potential causes. And finally, metaplasia. So this is where you get cell type changes. So one cell type is replaced for another. So, for example, lung cancer caused by smoking. And so there are lots of causes of cell damage, and I'm not going to just read out each of these because you know a lot of these. But the key things to think about, you can get physical damage, you can get metabolic, you can get radiation, lack of nutrients, nicotine and other chemical agents, microbial, so viruses, bacteria, genetics are involved. So there are lots of various things that can actually lead to that cell damage, whether it's metaplasia, atrophy, hyperplasia, or hypertrophy. So things do go wrong in physiology, and that's where we're thinking about pathophysiology, and that's what we're really coming into right now. So you might be nice and healthy, you've got your normal little cell physiology going on, and then you get a disease. and you get those disease mechanisms, and those disease mechanisms are what is causing that disease pathophysiology. And when you get that pathophysiology, you're getting changes to what's going on in your body, changes to your physiology, and that leads to a whole series of signs and symptoms, a large number of which are entirely predictable based on the disease process going on. So if you know how an organ works and you know what the disease is doing, you can start to predict some of the signs and symptoms. And then as a clinician might come in, they might have a little look at you, they'd talk to you, they'd examine you, they'd send off some investigations, they'll come up with a diagnosis. And then they'll go, oh, we need to treat that, so they'll give you a treatment. And that treatment, the whole plan of that treatment is to turn the pathophysiology back into normal physiology and to maintain your health. So it's kind of this whole cycle of what's going on. And the whole key point is you've got your normal physiology, might change during a disease, but we want to bring it back to normal homeostatic mechanisms. So normal physiology, normal homeostasis. So thinking about some of the processes that go on, like I said, the pathophysiology can lead to signs and symptoms. So there is a subtle difference between what a sign and a symptom is. So a symptom is a feeling. So if you have a symptom of a headache, that's what you're feeling. You might be feeling hot. You might be feeling generally unwell. You might be feeling cold. You might present with those feelings in an acute time frame, so really, really acute onset, really rapid, or chronic over a prolonged period of time. Those presentations, it might be local, so you might just have a feeling or an injury in one joint or one finger or one hand or one leg, or it might be systemic. You might feel generally unwell throughout your whole body. You might be feeling really, really hot throughout. And like I said, the signs and the symptoms, remember the symptoms were how you're feeling, the signs are what has been measured. So your symptom might be feeling hot, your temperature as a sign is 38.9 degrees in this case. So that is the sign, it's measurable. You might have inflammation and swelling somewhere. We do an inflammatory marker on you and we can detect how much inflammation you've got, or as a crude measure. We can measure your blood pressure. That is a sign. We can measure your platelets, so the amount of platelets you have for blood clotting. That is again, it's a sign because it's kind of measurable. And so when we're looking at these things, when we're looking at these signs, we're then doing the investigation to see, are they in the normal range? Does that 38.9 temperature, is that a normal level? And the answer is no, it's out of the normal level. So it's in that kind of pathophysiological range. Do you have normal inflammatory markers? Have you got this little baseline, or have you of inflammatory markers fairly low, or have you got a high level? Have you got a lot of inflammatory response going on? So why does it matter? Well, pathophysiology explains why patients develop symptoms, why tests change, and how treatment works.